21, we want to welcome to the program from the TV show The Doctors, Dr. Rachael Ross. Good morning. How are you this morning?
Good morning. I'm doing fantastic. How about yourself?
I'm doing good myself. I've got to say just right off the bat, if you were my doctor, I'd be at the office every week for some kind of checkup or something. That's just the dog that I am. But now that I've got that out of my system here, welcome to the program. We were talking this morning about this measles outbreak that is looks like it's coming from California and starting to spread across the country. What's the thought in the medical world about this? Is there concern? Is there something that the average parent could be doing right now?
There is concern. It's interesting because I think the medical field is kind of split on the measles issue. You have one arm of the medical industry that feels like this is because we have a large number of parents now who feel kind of like that the measles, mumps, rubella vaccination is not one that they want to give their kids. They feel like something historically has made them feel as though that this vaccine was giving children autism. So
is that what it is?
We've got these people who really don't want to vaccinate their kids.
Okay.
Now, on the other hand, we have some physicians who are saying, well, we think that the main way that the measles is making this huge comeback are the kids who are vaccinated and are doing something called viral shedding, which basically means a little bit of virus is shedding out of their bodies as they're trying to become immune to the virus after they've gotten vaccines. So it's really difficult because you might speak to one physician who is very pro-vaccines, and you might speak to another one who thinks his vaccines are part of the problem, and then you might speak to another one who thinks that it's just because some very overly educated and overly paranoid parents have decided not to vaccinate their kids. So I'm somewhere in the middle on it. I don't really know what's happening other than the fact that measles is here. We're seeing more cases of it than we have since I've been a physician specifically. And I'll never forget the first case of measles I saw in the clinic. My dad was the one who pointed it out to me. It was a kid who came in, and this is the course. And then, I think it's important now for parents to understand what measles is.
Right. Yeah.
And how it's
educate us on that.
Itself.
Yeah, educate us on that because I forget what the measles do and the symptoms and what happens.
Yeah. So with measles, it starts out as a really high fever. And your child might have a runny nose. You might notice that their eyes are really, really watering. So kind of like just a faucet of eye watering, nose watering, and a high fever. And so then oftentimes you take them to the doctor's office, and since measles hasn't been something that we've been dealing with, a lot of times they send them home with just a little medication and say everything's going to go well. But what ultimately ends up happening is that fever stays really high, everything starts to get worse, they start to get achy, and then they start to get spots on their body. And that's the thing that people characteristically consider to be measles. Now, you hear sometimes about people passing away as a result of measles. You hear about that more in underdeveloped countries than here in the United States. But ultimately what happens is that the measles can actually cause pneumonia. It can cause encephalitis. It can cause your brain to swell. So, and really there's no real treatment for it other than what we call supportive care, meaning giving fluids and pain medication and things to keep the fever down. So if you have a child or someone in your life who just is keeping and spiking a fever, they're really just kind of lethargic and sleepy and water kind of running out of their nose and out of their eyes, then that's a sign, let me take them and get them checked out.
Should be a little bit
concerned. I'm recommending everybody make sure that they're vaccinated adequately with the measles, mumps, and rubella. If you're not sure whether you've had the vaccination or not, you can go to your doctor's office, and what we can do is what's called a titer, and we can draw your blood and see whether or not you actually are immune to it or not. And that's kind of where we need to go with it because we really want people to get vaccinated as much as possible here.
Okay, Dr. Rachael Ross there. And let me ask one more question on that, then we'll move on to some of the other stuff here. Is that age specific? Is it more of a child's disease, a younger person's disease, or anybody open to that?
It is. We're seeing it mostly in kids right now because most of people our age or a little older have had the measles, mumps, and rubella and or have either had the measles as a kid or actually have been immunized against it. So we're really seeing it mostly in kids, but the people who are most vulnerable to measles and a measles outbreak are people who are immune compromised, so people who already have chronic illnesses or they're elderly or they are babies. So these are the groups that we have to be very careful about. So the outbreak that started here in California at Disneyland, it's a huge issue because so many young people and kids come through Disneyland, and so measles is spread by respiratory droplets. So, if you're in the grocery store and someone sneezes and you don't want to feel bad and cover your face and run off, I say forget that. Cover your face and run off, because it really is that simple for someone to sneeze into the air. The respiratory droplet is there. Sneezes can stay around in the air for seconds, minutes sometimes, and you're walking through without really realizing it, and then you breathe in one of the respiratory droplets or you touch it on your cart. So it is all about the same precautions we say with the flu and trying to prevent from getting the flu. It's the same things you want to do with preventing the measles. Get vaccinated and be pretty careful when you're out and about and somebody's hacking and coughing and sneezing.
Now we've scared everybody, and those that are hacking and coughing are really going to feel guilty. Let's talk about the show, The Doctors. You have some exciting stuff coming up. In fact, this week, Justin Bieber is going to make a surprise appearance on The Doctors.
Yes, on the 5th, Justin Bieber comes by, and a young lady on the show who is a huge Justin Bieber fan and has, actually had a huge medical trial where she was burned. And so Justin Bieber comes by to do this very touching tribute to her, and, it just kind of shows that even though this guy is out in the media and everybody's giving him a hard time, he came to the studio, was a first-class gentleman, treated everybody with respect, was kind to the young lady, and just really... he's actually one of the biggest entertainers in the world, but for all intents and purposes, everybody will tell you that when he came in, he just exuded nice guy, so I don't know what's going on with his image, and he certainly needs to work to repair some of it, but he seemed like a first-class citizen there, and it's a very touching episode, and it airs on the 5th, and, it's an opportunity for you to learn about one young lady's struggle, but also to see, a popular pop star come through and really try to, spread some sunshine on the situation.
Well, that's very cool. One of the other shows coming up, you've got some very interesting stuff all month long. Smaller at the Altar, that's happening in a week. Talk about real quick what's happening on that episode.
Yeah, Smaller at the Altar. It's kind of cool. We're taking 3 teams of fiancés, and they are competing for almost a dream wedding. So whoever loses the most weight is going to win, and so we have them on periodically to do different competitions. So the first competition involves a 3-tiered wedding cake and the ladies. So it gets really funny. It's really interesting. But the coolest part was to see their fiancés cheering them on, like, "Go, honey, I love you, I love you," and to kind of see who ends up winning. So it's a great thing, and I think it's going to inspire women who are already planning their own weddings to kind of do some of the similar things, which is, as a couple, some lifestyle changes so that we can all get into those dresses and, feel very comfortable about our day.
All right. Dr. Rachael Ross from The Doctors. It's a fun show to watch. It's always interesting as well. Thank you very much for the information you gave us this morning. And I look forward to having you back sometime, and I'll see you at my next appointment, okay?
Yes, it sounds good. See you soon.
Thank you very much. Bye-bye.
My pleasure.